Hey, good morning.
Good morning.
How's it going?
Good. How are you?
Good. Hector?
Top of the morning.
Casey, how are you? So back again at Oxford Exchange and talking about another topic that we see a lot that is something that, again, we carefully pick these topics based on really utility. I mean, it's like, really, how can we help you? I mean, people out there looking for things they may be dealing with, and hopefully you stumble across this one because, as I was talking to Dr. A, in my dental journey, it's like, how do I decide what I want to focus my energy on? And it's the same way kind of like when I'm buying technology. I don't just buy the best new shiny gadget. I buy the gadgets that I think are going to help my patients. And same thing with what I decide to try to learn about in dentistry. It's like, what is going to help my patient base? So in the beginning, in the 90s, if you can imagine, it was about learning about occlusion, right? We talk about occlusion a lot. Occlusion is a buzzword, but behind that buzzword, there's a lot of substance. And spent the 90s learning about how the teeth come together, how they function together, how you treat wear. And then really in the 2000s, it became cosmetic dentistry. What is a cosmetic dentist? Is a cosmetic dentist different than a regular dentist? Well, how do you treat somebody cosmetically? What does that entail? Spent a long time learning about that. And on the other side of it now, I see that yes, the endeavor in those fields has really paid off on patient care. So what I'm seeing more and more, and I almost go into this like as a skeptic, because I really don't like jumping into a trend that I think is all sizzle, no steak. But this is something that we cannot put off any longer. We see so much of it, and it has become somewhat of an epidemic. And what is the buzzword that we're talking about now?
The buzzword we're talking about now is airway.
Yeah, airway.
So airway is one of the newer topics in dentistry that, again, buzzword, it's something where a lot of people are learning about it, and it's more prevalent. Kind of like you said, when you invested your time in learning occlusion and learning cosmetic dentistry, we're getting to the point where we're seeing airway issues, and we were wanting to invest our time in learning about it so we can treat our patients better.
Yeah, and it's like now when we're treatment planning a case, and if we're doing it with a study club, you can't get through a case without talking about airway.
Yep.
And again, being the skeptic, I'm thinking, is this just a trend? Is this, does this really matter? And there's no doubt it does. And what does a dentist have to do with airway? I mean, isn't this something another doctor should take care of, like an ear, nose, and throat doctor?
Well, the dentist...
We have enough to do, right?
We do, but we're also working in the mouth. I mean, we're the masters of the oral cavity. We're the people who are going to be looking in that area, and that's the airway. That's the opening. I mean, it's your mouth, it's your tongue, it's the back of your throat. I mean, we are going to be the people who say, take a look, and we're going to be able to take a look and see for those red flags or those.
So we're the first responders of airway issues, right? And can you talk about like what we would typically see in somebody that we would suspect has an airway issue?
Right. Yeah. So the airway issue is the idea that your airway is getting collapsed or narrowed, and we typically find it when people are sleeping that happens. So it's not allowing the passage of airflow to the lungs. And a buzzword or a common word used with airway issues or airway obstruction is sleep apnea.
Yes.
A lot of people know that word.
They're together, airway, sleep apnea, right?
Right. And so sleep apnea, it's actually defined as a sleeping disorder where you're repeatedly losing that ability to breathe while you're sleeping. And it could be repeating every few minutes, every few seconds, where you are not allowing that oxygen or that air to go and pass. And so when you're talking about, well, what are we going to be seeing as dentists, and how are we looking at these red flags that you might have an airway issue or sleep apnea? The first one we tend to see is tooth wear from grinding. So
right.
Yeah, people who have sleep obstruction or sleep airway issues are going to be typically bruxers. So they grind their teeth. We might be seeing fractures in the teeth, wear, and things like that. So we'll be kind of looking at those as maybe some red flags.
Right, and this is something that I started seeing because, again, dealing with occlusion, I started seeing wear pattern cases that I couldn't explain with occlusal issues on its own. And this is where I stumbled into airway issues, because these were patterns that I was seeing in a lot of time on young people as well that didn't make sense when it came to traditional occlusal issues or bruxism issues, and could only be explained by somebody having to posture their jaw forward and open their airway themselves, right? And I started seeing a big trend in people being referred from their ear, nose, and throat doctor to deal with the snoring issue. And people that couldn't wear the CPAPs, and we would make the sleep appliance for them. And one thing I can tell you about the sleep appliances is they work, because when people have been wearing them and they break, guess what? Their wives are saying, he needs a sleep appliance back.
Yep.
Not to just pick on the guys, but you can't do without it, because first of all, the person's sleep is much better with the sleep appliance. And secondly, so is the other person that they're sleeping with, because they're a lot more quiet.
Yeah, we hear that a lot. That's kind of where we are looking at signs where you might be having this type of issue. And
Okay.
one of the big ones is, man, my spouse complains of me snoring all the time. And so when we're looking at, as a dentist, looking in the mouth and seeing, okay, what are the signs that you might be having an issue like this? So it could be you're complaining of snoring, you have fatigue during the day, even though you're kind of sleeping and trying your best to get to bed on time and get a full night's rest, you still have that during the day fatigue. Another sign that you might be having airway obstruction issues is waking up gasping for air or choking for air, and that's
My
that
dad used to do
blockage.
that, right? You'd hear it, and stop breathing, and it's scary, right?
It is.
And so that has an effect
Mhm.
on oxygenation of your brain,
Exactly. Yeah, you're not letting that oxygen.
early cognitive decline.
Mhm. Yeah, it has a lot of systemic effects having this type of airway issue, which is where, as a dentist, we are seeing those red flags and things happening with your teeth, but we're not only taking a look and worrying about your oral cavity, we worry about your systemic health as well.
Sure.
And so that's one of the main reasons why we also want to learn a lot more about this topic.
You know, one thing that I've seen as well, something I could not explain by normal patterns that I've looked at in the past, and again, is sometimes a wife is telling me about this, is bad breath.
Right. And if you have this issue, you might be more of a mouth breather and you have less saliva flow. So that's contributing to the bacteria in your mouth that can have bad breath.
Because saliva is antibacterial.
Exactly. And then when you have that more bad bacteria, not the good bacteria, you can get more dental decay.
I've seen that for sure. Yeah. Which is, who's going to find that but your dentist? So the bad breath, the decay, the worn teeth. Yeah, that's all our area of expertise. And the bad breath is, baffled me in the past, because I'm starting to think, okay, they got periodontal disease. It's a different type of bad breath. You become like an expert in bad breath, right? This type of bad breath has a distinct odor to it. And when you rule out, the periodontal disease, or somebody not just being hygienic enough, and you're looking, you're like, actually his gums are in good shape and he's brushing everything really well. And then you start to all of a sudden see the other signs that go along with it and say, this is an airway issue. So what else can you see? I mean, the tongue, right?
Yeah, the tongue is a super important muscle in the mouth. And when we are taking a look at the space that you have in your mouth, we are looking at the tongue. Does the tongue have enough room? Because many times the tongue, once you're sleeping and your muscles relax, will go back and be what blocks the airway.
Right.
So analyzing your tongue, do you have enough room for it? And ways that we know if you do or do not have enough room, we look at the arch form. So the way that your teeth are,
Yeah.
if you have a very narrow arch form where your teeth are very close together, Another sign that maybe your tongue doesn't have enough room, you'll see little marks on your tongue like you're
For
biting on your
sure,
tongue.
yeah. I've seen that a lot. And also I can recognize it sometimes when you're working on a patient and you're constantly battling tongue.
It's strong.
It's strong, and specifically somebody who has more airway issues, their tongue is very protective of that airway because it doesn't have any room. It's constantly pushing
Right.
against the teeth. And when you try to go in there and work, it's really pushing against us.
Yeah, we joke around, we're always battling the tongue in those cases.
Compared to somebody else whose tongue is very relaxed and they're sitting down in the chair and it seems like you have all the room in the world to work, those are people who are lucky. I mean, they have an abundance of room, and it's a luxury nowadays,
yeah.
because a lot of people don't and have some degree of airway obstruction.
Right, yeah, and so we're able to classify that airway space that you have between 1 and 4, 4 being more extreme, where that tongue is really blocking that full
You're talking
space.
about the Malapati.
Yeah, Mallampati classifications. And so we look at things comprehensively. And so we're looking at that as well. That's another one of those red flags. If we can already tell that that tongue is blocking that airway space at hello,
Yeah.
we imagine what it is when they're sleeping, when their muscles are
And
actually
they're laying
relaxed.
back
Right.
and having to gasp for air and move their jaw forward. So I think we get an idea of how your dentist can help you identify these type of things. Again, it comes down to where the rubber meets the road. What can we do for these patients?
Yeah, there's a couple treatment modalities for this. And again, it's all about allowing the room for your tongue and trying to prevent that airway from collapsing or getting blocked. So one of the first things the dentist might recommend if they see you have that narrow arch form is to open up that arch form, move the teeth. Right.
Yeah, it's nice when you look at a narrow arch like that, and patients know it. They're like, my teeth don't show enough in the back. They want that wider Julia Roberts type of arch form, right? You can picture that, where when you smile, you see the teeth all the way back to your first molar. That's the opposite of a narrow arch, but it's also very healthy. And it also looks good.
Right. Yeah, it has multiple benefits.
So if you're somebody and you're looking in the mirror and you're like, I'm not showing enough of my teeth, something like Invisalign can help a lot with that for sure. So again, it's form and function. You can improve the airway and also improve the aesthetics of it. And you can imagine now it's like your tongue has room.
Yes, absolutely. So that's one of the first things we might recommend. Now let's say you don't want to go through Invisalign. We might find another treatment modality, which would be creating an appliance, something that you would wear at night to help posture your jaw forward, to get your jaw forward, to allow the room for your tongue.
Right, and that's the mandibular advancement device, like the TAP appliance.
Right, that's
and
right.
Those are very effective. You know what I find too, and I'm sure you're going to get to this one next, is the CPAP machine. We see so many people with the CPAP, but a lot of people who just cannot wear it.
Yeah. The CPAP, the idea behind it is it's giving continuous pressure of air to try to keep that airway open, but it's a mask that you're wearing at night. Some don't like wearing it.
Yeah, and they've come a long way. They've gotten better and better and less intrusive, but still the patients that end up not being able to wear it kind of come into their dentist eventually and look for maybe the TAP appliance or something like that.
Yeah, we have a case of a patient who has tried the CPAP and now they're asking for the TAP appliance. It's kind of like the options. You're trying to see what fits you best and what allows you to get a good night's sleep.
What else?
Well, in a non-surgical way where you're thinking about, all right, what can you do as the patient at home to try to help? It tends to be a bit of a lifestyle change where you're trying to control the factors or the risks that can have that airway issue come up. And so we recommend, you avoid sleeping in a position that kind of brings your jaw back. So if you're a back sleeper, maybe sleep more on your side and change the sleep position to see what is more comfortable for you to try to prevent that obstruction of your tongue.
Okay.
Another lifestyle change could be avoiding any type of alcohol or sedatives before going to bed throughout the day. And then it can also be weight loss. A risk factor for having an airway issue tends to be obesity or larger circumference of the neck.
Okay. And as far as what have you seen that's the most effective way for patients that have had the most success in treating these airway issues?
I think a long-term success, it's really the Invisalign. Getting the teeth moved out of the way. Because we already can get the etiology. We like to think of things of, all right, this is happening, but why? So we're taking care of that.
So
why.
really getting to the root cause of issues. And you know, I've seen something too where if you're really having to do a lot of expansion, it's this Marfee procedure.
Yeah,
Can you talk about that?
Marfee. So it's a palatal expander device. And so it's on the roof of your mouth that it goes, and it's pushing the teeth out and getting that arch more open. And it's something that, from my understanding, and again, we're learning about airway, we're learning all of these treatment modalities. I always thought that was something more for younger kids or younger adults as they're developing.
Right. Phase 1 orthodontic appliances, right?
And we're kind of seeing it being used more for adults now as a device to really push that arch open and give you the room that you need.
Right, with the idea that with children, your jaw is still developing, so you can take advantage of that plasticity and push it along, whereas with an adult, that suture line is already formed. But this Marfee procedure for adults has some surgical component to it that can open it and really get a change. And what we're learned to look at is the distance between the molars, and I think about 35 millimeters tends to be a number that we look at is the limitation of which you may want to expand that. And again, kind of a developing field, but those who have that restriction, if you can open it up to 10 millimeters or more, it changes everything as far as your airway. So that literally can go in and improve the airway from the root cause of the structure. You change the structure and it's going to improve your airway.
We're talking about this, and again, we're focusing on the systemic health. So we're looking at why this is happening and why you would want to treat it. Some people might say, yeah, I have this issue, I just deal with it. Yeah, it's not that big of a deal. My wife doesn't complain about my snoring, and yeah, we're picking on the guys, but it tends to be more the men that have to deal with sleep obstruction issues with airway. So we're talking about, why would you care? Why do you want to get this taken care of? And it's the long-term systemic effects of this issue. You're not allowing oxygenation into the blood. I mean, that's going to affect your whole system. You're not going to have enough oxygen in terms of your heart. You might have heart disease, increased risk of stroke. It's also stress on the cardiovascular system. And then it can also affect your cognitive function as well.
Yeah.
You are going to have more fatigue during the day, maybe some memory loss. And so there's a lot of things long-term that, and we see this actually in younger people too.
Yeah.
And that's kind of why we're thinking about where you're going to be in 10 to 20 years if you have this going on.
And especially on the younger person that has advanced tooth wear, it's not sustainable. And the issue is, we can show pictures of patients that suffer from this, is if you lose that enamel, which is the hardest substance in the body, and you're 35 years old, and you start to notice it because your teeth are really short, and it's stemming from airway. It's like, yes, we can fix the teeth, but if you don't fix the airway issue, it's going to break the porcelain. So that's really why we've had to learn about this, because if you're investing in the money to fix the damage from the teeth, which you're going to want to do that because you don't like the way that looks, it's like, how are we going to keep it that way? And so that is really what the focus is once you can fix the teeth, open the airway so that you can not damage that. And sometimes too, it's all linked together because we see GERD with the situation. We see TMJ problems with these situations where it's stemmed from airway. And the TMJ problem comes from the fact that you're having to posture your jaw forward so much that you stretch these ligaments and damage the ligaments to the point where you can do permanent damage to where now your back teeth don't fit together. And we see patients sometimes, like all of a sudden my bite changed and I can't get my back teeth together. And those are severe cases of where it stemmed from airway, and now it's affected your TMJ and affected your teeth.
Yeah, when we kind of take a look at these things, we might include other specialties. We might have you get a sleep study. And if you have those TMJ issues, have you get imaging. So taking care of something like this early before something more damaging to the joint happens is going to be very important. And if you find that you have these type of things going on, the snoring, the wear, the GERD, fatigue during the day, ask your dentist. Ask, hey, do you see any risk of airway issues? And again, it's a newer topic. A lot of dentists are probably still learning about it. We are as well. But ask that question and have it evaluated.
Fantastic.